So today I'm going to be treating the knee using the Tecarpuls from Enraf Nonius. I'll come into knee and then we're going to go into the patella femoral joint. You'll see it's preloading the intensity at level 10, that's the highest level of the machine, and it's set 5 minutes. I like to go 1 minute per treatment head size. 5 minutes should easily get us around this patella femoral joint that we're treating today. Seen now back at the therapist's perspective, I'll bring the thermal camera in. You'll see we're hovering around 27-ish degrees, and you see the heat map there, mainly on the ligament on the outside. So we'll start by earthing the patient using the earthing electrode. It should go without saying that these patella femoral joint treatments are for chronic patellofemoral dysfunction and not for acute patellofemoral joint dysfunction. So I'm just going to put the earthing electrode underneath the calf there. Obviously don't touch the earthing electrode with the treatment head. It is quite close in this case, but I'll do my best. We're going to put some contact medium around where we want to go. So we want to go around the kneecap, around the patellofemoral joint, rather than straight down through it. I'm going to try and come in from the sides and from the edges. So bring the gel around. There's no way you're going to be able to avoid going over the kneecap. I'm just not going to go straight over the centre of it and hover around the centre of it. I'm going to go around the joint margin and the joint line. That does mean I will be picking up the quads tendon and the patella tendon. And we will be putting some heat into the quads and patella tendon. I'm not too worried about that. As you can see here, I'm going around the joint fairly rapidly. You'll find the patellofemoral joint will heat unevenly. So you'll get one part of the patellofemoral joint will feel warmer than the other, or others, and you'll have to adjust the intensity or stop going over that part as much. In my experience, the outer part of the patellofemoral joint is particularly susceptible to this, and you may find that you start going across the centre more and towards the inside edge more, or you just turn the intensity down. This is a good treatment for patellofemoral joint problems. There's a different treatment for patella tendon. This is an effective treatment for people who have chronic problems with their patellofemoral joint, and particularly those people who are suffering from chondral changes, arthritic changes, whatever you might want to call them nowadays, problems in the patellofemoral joint. It tends to be best reserved for people who need some sort of treatment to reduce pain, but understand that this will not necessarily be a cure for their patellofemoral joint problem. They're looking really for symptom management and management of the condition. I'm going to fast forward now to the end of the treatment because this is a long treatment. Once we get to the end of the treatment, I'll bring the thermal camera back in. You can see the thermal map has changed. We're up at low 30 degrees here, 33-ish, and you can see the patellofemoral joint itself was much warmer.